Communities need certain resources, even small communities. So you've got to have a grocery store. You've got to have a post office. You've got to have certain other resources. And one of the most important is health care, particularly primary care.
We have been looking for a long time for a solution to one of the most critical problems we have here on the Plateau, and that's a lack of having primary care physicians.
That's what people have been crying for a long time, is just consistency in the healthcare.
The area has had challenges for years trying to keep primary care physicians busy enough during the off-season and not overwhelmed during the season.
It is critical for the lifestyle that we lead here on the Plateau to be able to have access to affordable primary care.
Having access to health care is just going to make for a healthier community, and isn't that great for everybody? But then also to be able to have that as a selling point to families like ours coming into this area, I think makes a great case. I mean, we have great schools and now we have great health care, and we live in a beautiful environment. Like, why wouldn't you come here?
What is more important to you than being comfortable here than health care? That's the missing ingredient here.
And just general access to health care is going to be a game changer for our community.
I need a physician much closer than an hour and a half away, someone that I can see for simple things.
One of the problems in not having enough primary care access here over the last few years is that many people who might want to live here the entire year have decided they're not going to do that. They're going to live here only during the season, and then they're going to go home, wherever that happens to be, because that's where they have their health care.
As a parent, it's also hard to have to drive 30 minutes to 2 hours to get medical care for my children or myself. And also, even when our employees get sick, if they have to go 30, 45 minutes away, it adds time away from work.
And so oftentimes what happens is they just go without.
As we become a more year-round community, which I think by definition is a more sustainable community economically, it's more important than ever that we're able to have adequate health care right here on the Plateau instead of having to go off the mountain to get it.
The goal of the foundation was to find an answer to the problem of lack of health care on the Plateau. And after a lot of research and a lot of background checking, we came up that the best method of handling this would be to join forces with Blue Ridge Health and MAHEC, the Mountain Area Educational Center in Asheville, and put them together into a primary care clinic and teaching facility that would allow us to stabilize the community, but also encourage doctors to stay here.
The Blue Ridge Health Clinic, Highlands Cashers, is going to open at the end of June.
Blue Ridge Health has been around for almost 60 years now. Their specialty is providing primary care and a variety of ancillary services in communities that are relatively small and rural.
They not only provide medical care, they provide dental, there are mental health services, pharmacy services.
Their type of experience and the type of practice they have fits Highlands and Cashers ideally.
They're knowledgeable on how to serve that community, and I think that it's really the answer to a prayer.
With the growth that the Plateau has seen in the last several years, we absolutely need more day-to-day routine medical care here on the Plateau.
And so the idea is to bring doctors here and then to train doctors here, and those that train here will stay here.
With Blue Ridge Healthcare kind of mentoring to new doctors that are coming out of medical school and teaching them what it's like to serve in a rural community, is really exciting.
And you really form strong patient-doctor relationships. And that can span decades, and you can end up delivering children of patients that you saw as children. And that's really special.
I'm really excited about seeing Blue Ridge Health Highland Cashers open. And I'm just proud to see the 2 doctors have been hired. We have the location at the Jane Woodruff Clinic over at the Highlands Cashers Hospital location.
That's really what the community needs. We think that they will do very well. We think the community will really take to them.
I would say that's one of probably the top 3 things that are going to make this a real year-round community, a place where people can come and not just vacation, not just have a second home, but live year-round.
It means having stability in your health care. And one of the biggest problems here is we've had no stability in the healthcare. And so this idea of putting together the Blue Ridge and the MAHEC with the backing of the foundation is an answer to a long-term critical problem.
To be able to have that within minutes from where we are will be amazing.
I am absolutely thrilled that we have this initiative of having the Blue Ridge Health and Highlands Cashiers working together for this new healthcare center.